Greetings to our wonderful RFA family. At the very outset, would like to thank you all for having faith in us and joining the RFA webinar in tremendous number. Your mentor this side. Is my voice audible and clear to all of you out there? Hi, can you all hear me? That's perfect. Thank you very much. Thank you. Give me a thumbs up. Great. Thank you, Mehreen. Thank you very much, my dearest Mehreen Shaima. Thank you so much, Iman. Warm welcome to all the students out there. It's indeed our pleasure to extend a cheerful welcome to all of you, and your presence indeed is a source of happiness always. Thank you very much, Anita. Happy to see you here. Hello, Muna. Hi, Hua. Hello, my dearest Omar. Thank you so much for joining in. Wa alaikum assalam wa rahmatullah Javeria. Thank you so much for joining in. Thank you, Vifa. Thank you, all of you, to join in for the webinar today. Hi, Mohni. Thank you so much. Thank you for taking out your precious time. All right, so we are meeting today for the introduction to the MRCPI and the formal starting with this introduction to the course as well. I can understand that how anxious you guys are in the study group to start. You people are already approaching 100, so that's a very good strength to study together, hands in hands, aiming the exam as well. Thank you so much, Hoa. My pleasure, sweetheart. Thank you. All right, so before we begin with the agenda today, I've got lots of things to discuss with you guys. I need to tell you because I know the background of many students in terms of taking European board exams, in terms of taking the MRCOG. Before starting any study pattern, many of you know me from different courses, from different obstetrics and gynecology degrees, which you people have attained already. Belief and faith is something which is the most important element in your success. I always say that you will never grab an opportunity if you think that you will fail. Your confidence undoubtedly is needed and yourself thinking that, yes, you are a successful individual. Now, trust yourself. And only those who trust themselves that good things will happen, believe me, good things happen to them. Now, you all have your experiences of different types of studies in different parts, like you've done MRCOG, you've done your local degrees, you have taken your local exams. It's nothing new. The start which we are going to take now, it's nothing new, but we need to understand what's different here. We need to understand that how the things are comparable, and we need to make it easy. After today's session, you people would understand that MRCPI, already you guys know 60 to 70%. What we need to know is only that remaining 30%, how we would know it, that will become super duper easy for you guys after the session would get completed and we'll have a single topic discussion today. Seher, somebody please write in the chat box for Seher that she should get connected to the audio. Hoa, please help Seher. She's not connected to the audio. Thank you so much. All right, so at the very first place, why are we deciding to take? Good day, Zaw. Thank you very much for joining in. I hope you and family are fine. You're always in my prayers, Zaw. Thank you so much for joining in. Why are we taking this MRCPI exam? How do we prepare for this MRCPI exam? Why do students, despite being comparatively an easy exam, why do students, they fail? And how we can make it in one go. And then we are going to discuss for all the course students and the open students who are asking about the course that what would be the outline of preparation which we would do together. The shining stars which had been passing in the September 2022 exam, undoubtedly they started like you guys. It was nothing different, but when they started off, they were anxious like you guys. We had created examples with these highest scores and spectacular results. These shining stars for September 2022. Let's have a glimpse. round of applause for all these champions. I would like thundering round of applause for these. They definitely broke all the previous records. Farah Ali with 80%, Ahmed Kamal 77, Priyanka 76, Amrita 76, and lots of high percentages were there. But there was a time when they started like you. There was a day when they took the first step. And today they made their names on the success board. I've got two examples here. I've got Mariam Nabil Malik and I've got Inas. I would just like them to tell you guys that how this MRCPI, you can be focused from the start. I know, again, background of each student is different, but what I want is that day one is the right step which we are taking. Day one, we know that what we have to cover, we divide our time accordingly, and we manage that accordingly. Hello, hi, Mariam. How are you doing? Hi, Mariam.
Hello. Am I audible to you?
How does it feel, my dear? Yes, you're absolutely audible. How does it feel being on the scoreboard and being one of the champions?
Yeah, it's just awesome. It's just awesome. You can feel my feelings.
Exactly. Yes, I can totally understand. Mariam, what would be that tip which you would like to give? Because students are starting now they're aiming this March 2023 MRCPI written. So what would be your suggestion to them that as just a recent exam you have taken and you passed the recent exam? So they would like to hear from your side, please.
Thank you for giving me this opportunity, Dr. Sedra. First of all, that it is a doable thing, which many of us like me think before sitting on exam that we can't do it, but it's a very doable exam. But it's neither easy nor difficult. The main thing is to focus and keep on smart learning, which you have told us all the time that it is all about smart learning. Focus on questions, focus on the topic, daily questions. What I learned from all these experiences, from all the exams, that exam is all about the practice, all about questions. The more you do the questions, the more you do them wrong, and then go to the guidelines, or to ask Dr. Sidra. So where are you missing in these questions? What is the basic point you are missing in those questions? So the exam would be easy. MRCOG is not MRCOG is lengthy. The same tip goes for the MRCOG part 2 also, and MRCPI 2 written exam also. Question is the key to success. And what about RFA? My concern is RFA, that RFA has many questions, many good questions, good pool of questions, like exam based. Whenever you solve those questions, you will just feel like that you are sitting an exam. So it helps a lot. All the website of RFA is very what would I say, it's enough, more than enough to prepare the exam. And it's on the main thing is also is that if we are so much busy in our lives that we can't make sometimes notes, we are not much focused. So what I feel that after joining RFA, that my all things are on one side. Now I don't have to go anywhere else. I just opened the RFA website and I got all the topics, especially talks.
Okay.
Which I love, because it was very difficult for me to move here and there and just search all the groups and search all the
Mariam, it's difficult for everyone out there. Why? Because nobody's free only to do MRCPI or MRCOG, you know.
Yes.
And today, like when I'm comparing the diabetes, a nice guideline, and the Irish one, and in the end, I made just 3 slides, the flashcards. That this 3, if you do, your complete topic is done. So at the end of the day, what we need is that, okay, what is required out of the huge curriculum? And as Mariam is saying, I would like to second that at the very get-go, friends and family, that practicing questions is the key. The more you're going to practice, the more wrong attempts you will make. Definitely that adds on to your right attempts in the exam.
And I will also add on that Dr. Sidra is like a mentor. Dr. Sidra's way of teaching is so much superb. We're out of this world, I think. So it's just like we are doing A, B, C, D, E, F, G of MRCPI and MRCOG. So it's very good. I'm just literally much impressed, and I'm much satisfied with it. Where I know that whenever I will start my any exam study, and if Dr. Sidra is here, I will pass it, inshallah.
So grateful, Mariam, for all this love, and wish you all the best for your
No,
future.
you deserve this. You deserve this. It's not only the words, but you deserve this.
Thank you so
Because
much.
you are doing like that. You are doing like that. I have seen many people, many teachers are there, but you are doing like this.
Thank you so much, Mariam. We have got Inas here, and Inas had been practicing so much for this exam in the September that I used to tell her that Inas, now hardly anything would be there which you have not practiced. Hello, Inas, my girl. How are you doing?
Hi,
Hi,
Dr.
Inas.
Sidra.
Hello, my dearest. How are you? Happy to have you here. How do you feel
Thank you
yourself to
very
be on
much.
the scoreboard now and with lots and lots of efforts at the back?
Still, I cannot believe it until
I
now.
I can totally understand. Congratulations once again, my dear.
Thank you very
How
much.
do you think that your preparation was different this time?
Actually, I was reading too much, like
Yes.
too much reading, but I was not practicing questions. That
Everybody
was my problem.
to her very carefully because she can exactly tell you that what mistakes we make in the preparation. Yes, Inas, my dear.
Yes, I was reading. I think I was lost with too much reading. I was having a problem with solving questions.
Yes.
I always felt that the people who are putting the exam, they are trying to trick me. It cannot be that simple. The keywords, these things, I was never following this. And although I have a very difficult, I have a lot of difficulty in managing my time because of my house responsibility, my job, and this, but still I was able to do it. Last time I stick to the plan and I concentrated on the practicing the questions more.
Yes.
And I was following the groups, the Telegram groups, WhatsApp groups. Even if I cannot attend the live session, I'm attending the recording. If you have doubt, the practicing questions between the candidates, also, they will discuss, like, it's the same way of thinking. If somebody can have a mistake, I can think the same way. So we are clearing for each other, and they had all the materials. They are sharing it. The team was there for us. I mean, technical support all the time. Of course, Dr. Asida, I will keep thanking you forever. But the thing about my exam, because I failed so many times in many exams because I had this problem. When they announced the day for the applications for MRCPI, and of course they are limited seats, I received a call from Dr. Sidra that she said, Ines, apply. I said, no, I'm not applying. I'm not going to any exam. I'm done with the exam thing. Apply just for me. And if you are got accepted, don't take the exam. I said, no, I'm not applying. And then at the end, I cannot say no to Dr. Sidra. And I applied. And I was, I don't know. I just I left myself for her. I followed her plan. And on the date of the results, I was the first one to call her.
Yes. And we actually
came
came to know
earlier.
that result is announced by Inas only. She was the first one in the study group. Guys, result has been announced and we've received the email and she passed. And believe me, that still that minute, I cannot forget that what was the feeling at that very moment. Inas, you were a huge responsibility, but this time, believe me, you didn't leave any stone unturned. You did everything. And I knew that you would pass, though it was such a huge responsibility, claiming that prior to your appearing that please do it for me, you're passing, but you did it. Thank you so much for clarifying to the students, my dear. God bless you in your
very much, Dr.
Thank you so much.
Yeah,
You people are RFA gems, and thank you so much. May you, Mariam, all this batch which is in front of us, friends, they are appearing for the next MRCPI OSCE as well. So lots of prayers for all of them. God bless you all. Thank you so much. So here I have one of the student who has been always smart and so particular in knowing and calculated in knowing that this is something which would make me score higher. I've got Topper who has scored and who actually broke all the records of RFA, and in fact, any course in the world getting 80% being highest score, Farah. And RFA champions, I am expecting that my March batch would actually maintain the same standard. How are you doing, Farah? Big hello from the entire RFA family.
Hi, Dr. Sidra. Hello. How are you?
I just
Yeah, thank you so much.
board makes me nostalgic again. How do you feel today? The next
Yeah.
batch is starting and today is their first day, Farah.
Yeah, actually, actually I have been all and then to Dr. Sidra, and then
Thank you so
for
much.
MRCPI, and then for MRCPI also, I just focused on whatever Dr. Sidra was teaching, like all the MCQs, all the recalls that they were telling us, Dr. Sidra and Dr. Chin in the course. So they were really, really helpful. I went through all of them like 2-3 times, and along with that, the slides of Dr. Sidra and the previous lectures that I prepared for MRCOG Part 2 from her lectures actually. So they all really, really helped me a lot. And attempting this exam is not only studying the theory.
Yes, when you were
Yeah.
in the MRCPI batch, when we were doing the RFA fast track, I remember that all
Yeah.
those exam questions you were doing that repeatedly. So
Yeah,
what
yeah.
would be your suggestion for the students? Maybe many of them are starting just now. So how important, like Mariam was saying, and like Inas were saying, that it's very important basically to understand the practicing questions has got its vital importance, because
Yeah,
it
yeah.
many of things are different in the recalls as compared to MRCOG. So
Yeah.
how did you manage your last 1 month?
Last 1 month, actually, I was just doing MCQs, the questions that were given by RFA, by Dr. Sidra's these lectures, that fast track course, and whatever queries we had many sessions with Dr. Sidra as well as with Dr. Chen, and they were like open to all the questions, and we went through all these questions like many times, like at least 2-3 times you should go all these recalls, so that like question is in front of you and you know the answer already. So it was like very, very helpful from Dr. Sidra and all of the RFA teams. And yeah, reading theory is totally different than preparing for MCQs. Yeah.
Thank you so much, my dear Farah. So hoping the best, friends. Farah has been my student for MRCG Part 3, for MRCPI OSCE. We had been together, and
Yeah.
I wish her all the best for all the results.
Yeah.
Farah, thank you so much. May you shine always. Thank you for
Yeah,
giving.
thank you so much for your help. I really, really appreciate for all the help that you have provided. It's not possible without without the guidance that you provide, without the help and everything, and your motivation and the energy, the positive vibes that you have, they really, really mean a lot. It's like not, yeah, you keep us motivated, you keep us like energetic all the time, that you have to do it. I remember Dr. Sidra always used to say that during MRCPI preparation, you have got the seat with a very, very difficult, all the times applying, 2-3 times I applied, I could not get the seat for MRCPI written, and then finally I got the seat. And then Dr. Sidra said, like, you have got the seat with a lot of difficulty, now don't let it go, you have to do this.
Thank you so much, Farah, for taking all the words seriously and working in the right direction. You have been RFA champion and we are proud of you. Thank you so much. Thank you. Thank you for taking out precious time. Despite being in theater, friends, Farah took out time for you guys. Thank you. This motivation. Thank you, my dear.
Bye. Thank you.
Thank you. Bye-bye. All right, friends, to begin with, I wanted to tell you guys that the champions which we are seeing at the moment, they also started like you. They also had an introduction day. They also had lots of questions in mind. They also had the same study group, and there was a day when they took their first step. Today, you guys are taking big hello. Sheila is here out of the champions. Thank you so much for joining in. Sheila was busy. She had a multi-gravida in labor. Hi, Sheila. How are you doing?
Hi, ma'am.
Hi, happy to see you here, my dear. Thank you so much. How does it feel? Today we are starting March 2023 batch, my dear. Thank you so much for joining in. How do you feel and what are you going to suggest to upcoming students, my dear?
Yes, ma'am. First of all, I would like to thank you and RFA team so much that I could make it in first attempt. Actually, it is my immense pleasure and being here to talk about my experience with you. Actually, it is kind of different from MRCOJ Part 2, but it is doable. It is, ma'am has taught us in such a way that it is so easy and simple. Just we have to apply the knowledge. Just and to say to read from MRCOG, it's almost same modules. Most of the module topics are same, but only few Irish guidelines are different. That ma'am makes it so simple and easy to remember. So it's very easy, and the fast track course is must, because out of 100 single best answers, 50 are almost a repeat only. So fast track course and regular course I took ma'am, it was like, and to say I honestly accept that I read only ma'am's session notes, that's all. So thank you so much, ma'am. In this busy schedule, like I believed you 100%, and I followed only your notes, and I could make it in one go.
Thank you so
Like,
much,
thank
Sheila.
you
You are an
so much
example.
for
You are an example for all of you.
yes.
And reason to call Inas, Mariam, Farah, and you here today is that they all should know that there would be a time when they would be also at your place, and there was a time when you guys also started like them. So it's doable. This
Yes,
faith in ourselves is
yes,
very important. Thank you so much, Sheila. God bless you. Best of luck for your upcoming
yes.
results, my dear. Thank you so much. Thank you. All right, friends. So
Thank
these
you.
were the champions from September 2022 batch. Wanted to tell you guys that, again, this is doable. All these students also started being anxious and having this point of view that how we are going to do that and how we are going to manage. Now is the time that we are going to start. Now we are going to begin with the first intro, that why are we taking MRCPI at first place? Now, students, they say, definitely, yes, Moona, I'm coming to that, my dear. The students, they always think, why Royal College of Physicians of Ireland? The ones who are from the open group, you already are around 100 in the study group, right? But open group students, they always say that what is the benefit? Now, I would just like to tell you that the MRCPI in obstetrics and gynecology qualification is recognized by the General Medical Council in UK. And this does mean that international medical graduates can apply for full registration with license to practice in United Kingdom if they hold MRCPI in obstetrics and gynecology. Now, this was backed by RCPI President Professor Mary Horgan, that he said that this is a significant development that widens the training and employment opportunities for doctors who have achieved our postgraduate qualification. Our college has always had strong links and excellent collaborative relationships with our colleagues in UK. This is further recognition of this high esteem that our membership exams are held in as a mark of attaining high quality medical training, I unquote. It's very important. Thank you very much, Sheila, for joining in, my dear. It's very important to understand that what are the future prospects. Many of the students in Kingdom of Saudi Arabia, many of the students in United Arab Emirates, they all are taking the exam just to improve their pay skills, to improve their stature. And of course, it tends to have a benefit in your clinical practice as well. Now, the first question which we always have is that what is the format of the exam for which we are appearing? All of you, please, I need your attention, because if we understand the exam format, undoubtedly, yes, from day one, we are in the right direction. We have one exam paper, which is going to be 3 hours. The questions would only be single best answers. I repeat, only be single best answers. We do not have extended match questions in MRCPI written obstetrics and gynecology. These 100 single best answers would be there with 5 possible answers, A, B, C, D, and E, which you have to choose one out of them, and there is no negative marking. Looking at this, do you guys think, as compared to MRCOG, isn't it easy? Isn't the extended match question, friends, Moona and all my friends here, Mehreen, don't you guys think that when we have the extended match question, that is the scary part? The exhaustion undoubtedly is more when it comes to MRCOG. Why? Because we've got 3 hours and then 3 hours. We've got 2 papers. And what makes us go exhausted, what makes us go tired is the extended match question. This is not going to be in center. The college has again announced they started from the COVID, and still it is in the test reach application that you're going to open at your home, in your room. That is what you're going to have, right? Why not to take? When you're sitting at your home, when you have the same books to practice, when you've got 70% of the curriculum same, then why not to go with MRCPI? Why not to add on an additional obstetrics and gynecology degree with you? Do you guys understand? And thank you so much, Faridi, when you have me, when you've got RFA. Thank you so much. So in MRCOG, friends, Mehreen, Javeria, my sweetheart, you guys know that we did the Green Top guidelines. You people have been in nice guidelines, the talk articles, right? Here, what additional we are going to add on is going to be the Irish guidelines. All right. Now, out of all the Irish guidelines, we have certain which are different. There would be hardly 7. And I would tell you that how we have to do them. Once you will attend my sessions, you do not need anything else. You do not need to prepare any notes. And today I'll give you an example of this. I'll go into much detail in the sessions, but after that, I'll do a recap. In that recap, if you just manage to learn and remember those points, which I tell you, your memory requires only that repetition. That's it. Okay. Now, for all the newcomers, please, if you've got certain degrees and if you've got your fellowships, like MRCOG 1 gives you an exemption for MRCPI 1, right? Similarly, the Australian fellowship, the New Zealand, the South African fellowship, the fellowship for different countries, Malaysia, New Zealand, that all is given to be as an exemption for MRCPI 1. Whosoever has done MRCOG Part 1, thank you very much, sure, my dear. Whosoever is actually has completed MRCOG Part 1 is eligible to take MRCPI written direct. You just need to attach your result of MRCPI. Okay, MRCOG Part 1, you can take your MRCPI Part 2 written directly. From March year 2022, you need to have 18 months of post-registration training in obstetrics and gynecology, both 9 + 9 months. This is what we are aiming at. We all are aiming for, and today we are meeting to submit our documents and upload our applications. The exam date is 9th of March, year 2023, and we are starting our journey for the same. It would be remote invigilation. The opening date is Wednesday, 7th of December, 2022. The Telegram group from the opening of the registrations would be active with every moderator and the coordinator and the backend team, including me. We all would be there to help you guys. If anybody gets stuck up with uploading, everyone would be there to help. And for the last 2-3 years, we had been doing that according to your ease, that whenever any student gets stuck up somewhere, the others are there. So it's very active on the registration day. Please ensure that you all are going to, sure, Javeria, you all are going to apply on the very same day. Nobody is going to make a delay, right? You all would be applying on the very same day, that is on 7th of December. Undoubtedly, the closing date is 4th of January, but this is one of the problem and a challenge I would say that we face in MRCPI. Getting a seat for the first-time applicants is a challenge. So what does that mean? That means that the earlier we do that, the safer it is, the better it is. So I expect all of you, the moment it would be opened, Muna, last time it was 9 a.m. Irish time, but then again, whatever would be the announcement, we would definitely announce that, and just stay active in the group. You will get all the required information out there. Okay, and everybody would be there. You'll find that whatever query you have, everybody is going to help you out there. All right, the link where you're going to do Seher from home. From home. Okay, so everybody is going to do this. This is a remote invigilation on the test reach. All right, yes, Hawa, the ones who have applied earlier, last time, their all documents would be, when once you sign up, your all documents would be visible there. Just you need to fill in the application again. All right. Umar, last time, if it was uploaded, second time, the all documents are not required. Only the application, filling up the application is required, Umar. Right, Seher? Hoa, you did it last time, my dear. So this time, only the application filling is required. Okay, got it? All right, perfect. So if you people are newcomers, if you people are the first time applicants, I expect that your all documents are ready. You people are ready with a testimonial form, which has to be signed by 2 referees. If anybody has any concerns, you can get it signed by any doctor. Any doctor. Many of the students, they just got it signed by any colleague. Right? It can be a general practitioner, it can be a gynecologist, it can be a surgeon, it can be a medical specialist. Okay? By anyone, you can get it signed, please. But it is for the first time. The first time applicants, please, you people have to be sure that you have an attested copy of your primary medical degree, a recent color passport style photo that should be there, and MRCOD Part 1, or that equivalent qualification that makes you eligible to apply for the MRCPI Part 2 written exam, and along with that testimonial. Am I clear about the requirements? Today, you have to make it ready. All right, I'm talking to the first-time applicants. Today, you guys have to make it ready. Why? Because on that day, if scanned copies are ready, and I remember last time Talha and other Bangladesh students, they made folders, and they sent me PDFs that, ma'am, please check it, that everything is fine. Is it all okay? So make your PDF ready, because on that time, you just are going to upload the documents, right? Exactly. Yes, Aisha, when you sign up, you'll have all the documents already there, only the application, because your documents are already with them. Am I clear, everyone, that what is the requirement? Your passport style, recent color photograph, your attested copy of your primary medical degree, your Part 1 or equivalent qualification, which makes you eligible to sit in MRCPI Part 2 written, and a testimonial form. Am I clear? Yes, am I clear, please? Everybody, I'm talking to the new applicants. Did you guys understand that? Yes, that's perfect. Very well done. Okay, so we have to understand with this that it is an easy exam, as we discussed now. What is the reason that despite being easy, students, they do have failures as well? I always say that we need to have confidence in ourselves. If we have a non-focused preparation, like Inas was saying a little while ago, then we get lost in the curriculum. If we start reading and reading and reading, and at the end of the day, when it comes to reproducing the information, and you're not able to do that, then we are definitely at loss. We need to have a focused preparation and make our checklist from day one. Every student in the study group needs to know this is my time period. This is the minimum thing which I need to cover, and these examination strategy I need to follow, and this many revisions I have to do for myself. No stress would be there at the end, provided you guys understand that the preparation technique, it's focused and you're not having a backlog. From today, you should have a very focused mindset. It should not be a shaky mindset. I want only 3 words. I can do it. If you people are going to have this feel that how we are going to pass this exam, definitely yes. If a shaky start is there, we stay shaky throughout, and you'll feel the change in the study group. It's like a family. You people are studying together. I want that we have a very targeted approach. We are perfect in our time management from today, what we have to cover in the month of December, in the month of January, in the month of February, how we are going to do quick 3 revisions so that we are ready for 9th of March. I want your willpower that everything would be settled if we have a focused study pattern. I know that it's never a straight line in terms of smooth going. We have ups and downs like family circumstances. At times, kids, they get ill. At times, we have ups and downs in the health condition, family chores, the household conditions, hospital duties, everything would be there. But along with that, we would manage. People who had been doing it earlier, they also had all these problems, but they had faith in themselves. They were focused deep down inside. So what is the outline of the curriculum? You have separate channels of everything. For the RCPI, all the Irish guidelines are at one place. Like Farah, Inas, Sheila, they always saying that they were doing only that material that is on the website and my sessions. All the live sessions would be with me only, and that's going to cover up everything that is required for the exam. Now you have to understand that there are 42 guidelines, but out of them, 7 have different recommendations. The Green Top guidelines, we are going to do those which are not touched by the Irish guideline. While doing the guideline, I will tell you specifically this guideline, if you have already covered from the Green Top guideline, for example, vaginal birth after cesarean section, if you have done MARVA from VBAC Green Top guideline, it's absolutely okay. You need not open VBAC Irish guideline. Why? Because the Green Top guideline has absolutely the similar recommendations. Please do that, my dear Mohni. You can do that, please. It's always better that you upload the document after attestation. It's always a safe play. Okay, Mohni? All right. Nice guidelines we'll do like sub-fertility, like that of the certain which labor guidelines where we don't have the Irish recommendations, we would do from the NICE guidelines. Then the talk articles, there are certain talk articles which are very important from the Irish recommendations, from the Irish setup. We are going to do that as well. Okay, and the FSRH, that will be only for the summary that is required. Now, Sarah asks a question, is it enough we're going to start now? Sarah, if I know that you're going to start this very first exam, or have you read for your MRCOT or for that matter, the European board? American guidelines are not required, please. Yeah, ACOG is not required here for the Irish exam, okay? First time, if you start today and you know that what you have to cover, it won't be a trouble. But if you feel that today it would be, you can make a delay and you'll be able to do in 2 months, then it would be difficult. All right. So what is, I would like to guide you according to your basal knowledge in terms of what degree in obstetrics and gynecology you have achieved up till now. So that would give me a clue that what are those residual guidelines or the basis which you have to do that again. All right. So just drop testimonial, anybody can sign Hina. Anybody, any doctor around, any doctor of your hospital can sign your testimonial form. I hope you all have got the testimonial forms. Do you all have the testimonial forms? It's been posted in the open group as well. I see, Sarah, no worries. You can do that in 3 months. Absolutely, you can do that. Mehreen, please tag the moderator and write in the study group, Mehreen, please, that testimonial form so that you people can download and get it signed. Okay, right? Please do that. And after the session, I'm going to send it again for you guys. You all have to download the testimonial form. You have to take its printout, get signed by 2 referees and get it scanned copy and upload on the day of the opening up of the applications. All right. Okay, I'll do that in the study group. Don't worry at all. Okay. All right. Now, everybody has been stressing upon that we have to do questions. Omar, yes? Hina? So everybody's saying from where we have to do the questions. Now, the questions, we don't have any Irish book separately. We have to do from the same question pool, which you had been doing, or the ones who had been reading for the other exams like MRCOG. The same. Hi, Deepa. Happy to see you here, my dear. Warm welcome. So Andrew Sizer's book, Amanda Jones' book, we can do Sir Janesh Gupta's book. We have Mastering, we've got Succeeding. We've got both old and new Andrew Sizer. You can do Sir Kunjay's book, Sir Tahir Mahmood's book. You can do P. Sinha even has got good quality questions. We don't have extended match question, but it adds on to your practice. You can do 550 SPAs. You can do at the end extended match questions if you have time, just to add on the information. And we at RFA, we have made the all curriculum of RCPI in our practice book that's been there. And we are going to tell you that how you have to utilize that book side by side. Okay. Now, live sessions would be with me. Along with that, moderators and the coordinators would do the discussion of the topic daily. And after around 30 to 40 days, we'll start back from 2015, start practicing the exam questions as well. Right? You can apply, my dear Aisha. Yes, Aisha, you can. Sarah, yes, please. No matter you think that it's the first time you people are going to do, please do apply. Reason for that is that would help you guys in actually going in the role. For example, the students who had 1 or 2 applications done already and they didn't get the chance. So now this time they do have a chance a little more than others. Do you guys understand? There's always a first time of filling in the application, right? Yes. So you all have to fill in the application just to get in the row and just to get into that flow of like, okay, no matter it's a rejection for the first time, it's all right. Next time, it's higher chance that you get accepted for your seat and appearing in MRCPI party written. Do you guys understand that, please? Yeah. The moment you get registered, in 60-70 minutes, you get all the website access to you guys, which includes all the Irish separately, Irish summaries and the flashcards, along with the green top guidelines, the nice guidelines, the talk articles, and the course students who already have all the access to the material, they've got all the schedule ready as well. So this schedule we are going to follow. You people would have, according to the dates, the live session with me. I expect after that live session, that module gets completed. You solve the questions from there, you attend the live session, you complete your notes, and you follow the sequence and you solve the questions from the same portal. So that module is absolutely done. At the end, it's going to be 100 single best answers, which you guys have to do. All right, it's 7th. Anita, thank you very much, Safa. Thank you. All right, friends, so now we have to get started. We have to make this decision that we are taking this exam on March 2023. Today, we are meeting up for introduction. The dates of each session are given to you guys in your study group, and I expect you all to know the dates and we can decide for the time. Few of the students were saying that 2 p.m. GMT doesn't suit you guys. It's absolutely okay. Whatever is the mutual decision, we can decide, because I expect all of you to attend the live session. If at all there is some sort of a commitment, which is unavoidable, it's okay. We can do the next day you can listen to the racket, but what I expect is that more is the discussion, more is the interaction when you all attend the live session. And generally students, they say their confidence is really good after attending the live session. All right, that's okay, Mehreen, we can do that, please. 10 a.m. Okay, write in the study group, and everybody please decide on the timings today so that I can organize the schedule and the other sessions accordingly. If all of you agree to this, Mehreen, write in the study group, please. If all of you agree to this, then we'll fix the time accordingly so that you people are easy and maximum you guys can attend the session. So that's definitely going to be reassuring for me as well. Okay, please write it down in the study group and we're going to make a consensus on that. No worries at all. The newcomers, please, the payment link is available. All those who are messaging that they want to join. The old students, they don't have to join on this, please. They've got their own coupons and their extensions. So anybody who is in any of the course, please, they have to join on this extension only. All the students, they've got their extension links in their respective premium courses, please. Okay. And the newcomers, because of the booking being started, this coupon of RFA BOOKING GIFT RFA booking gift, that is valid. That would be till 24 hours after the booking as well. That would be working, please. This is 50% off. I will tell you, yes, Omar, I'm just coming to that. We have to review that. And before live sessions, they would give you the schedule. For example, now Gynae would be started. Okay, now Gynae would be started because your first session, Omar, is Gynae with me. Okay. So friends who are messaging me for the coupon for the March 2023, the new students, this would be working now. And then we are going to have again the complete price after the booking coupon gets expired. So you're going to sign up on this link, please. And after signing up, you're going to put the details of your card. And on got a coupon, you're going to put RFA booking gift without space, please. Do validate on the top. The price is going to reduce to 224. This is for the booking students who are actually interested in March 2023. After you see that the price has reduced, please, then you're going to validate. After validate, you can do the checkout as well. Okay, thank you so much. All right, so regarding the curriculum, regarding the preparation technique, and regarding the application for the exam, if any questions are there, we are going to settle those queries now, because now I'm going to guide you then about that how we have to take the preparation forward with one example topic, which we are doing today. Omar has a question that do we have to do the topics? Yes, Omar, you'll have the daily schedule. The Gynae daily schedule would be starting and you people would start module-wise discussion accordingly. So for instance, if I'm doing in the live session Gynae, so before that 1 week, you will be doing gynecology topics. Then you will open up your notes and attend my live session and add on those points, which I tell you at that very moment. All right. Hina has a question. What if we are busy for January MRCOG2? Hina, Anita, all my MRCOG2 students who are appearing in MRCOG2 January 2023, it's absolutely the right time. Please, extension of MRCPI is in your study group. You don't have to go to the open link because you're already in the MRCOG course. Now, you guys, what you have to do is that after completing your MRCOG2 January on your exam date, immediately after that, 30 days are absolutely sufficient to take this exam. Why? Because what you are learning at the moment is more than what is required for MRCPI, and it's going to be very fresh in terms of all the information and the applied clinical knowledge. So just in 30 days, you people would do your MRCPI, only the Irish guidelines and my sessions. That's it. You people do not need to go through the entire curriculum and the modules. For example, here I'm going to do that with this. Yes, I'm going to do all the details with them. For example, I will teach them urogynecology, complete, nice guideline, right? So you guys are already doing with me in MRCOG. Only when it will come to the last 30 days, you will do the differences from my sessions. That's it. And your job is done. It only requires 30 days to appear in MRCPI. I did in 18 days after my MRCOG, right? So it hardly requires that, provided you have a good grip. So what you're reading now, it's adding on to your MRCPI. Do you guys understand? What you're reading now is adding on to your MRCPI. No worries at all. Like today, I will tell you, Hina, if you'll attend, Faridi, if you'll attend today's topic, which I'm telling you, I'm going to give the detail, and in the end, I'll give you 4 slides. So if you guys do those 4 slides, you'll understand, okay, your diabetes is done. It's not a big deal, because what we need to learn is what are the differences, because the common things are 70 to 75%. Do you guys understand? Hina, Faridi, Aisha. Now, you know what students are doing? Students are taking January 23, then March 23, MRCPI, and then EPCOG May 23. Or the ones who are taking March 23 MRCPI, then they are taking May 23 European Board and July 23 MRCOG. So everybody is doing this, and this is the best technique. Why? Because it is always, no, my dear, may I know who is this dot, please? I can't see your name. You can rename yourself by just clicking on your dot. The question written is, that means it's better to do it after MRCOG exam. May I know your good name, please? Your name is not visible to us. Your question is valid. MRCOG is compared to the difficulty level is, yes, difficulty number 1. However, as compared to that, MRCPI is number 2, I would say. And the European Board is also, I would say, MRCPI and European Board, they're equal in terms of their, difficulty level. However, students, they not always take this MRCOG first. As I'm telling you, many March 2023 students are taking MRCOG in July 23. The benefit of taking all the theories in a continuity is that we tend to have the knowledge fresh. All right? That is, we tend to have the knowledge fresh. Mohini, please write in the study group, my dear. Here in the chat, we cannot decide. Please write the tentative time in the study group, and then we are going to make a consensus on that. Whatever you people would have the maximum, votes for, we are going to decide the live session time accordingly, sweetheart. Okay, my dearest. Thank you very much, my dear. Okay, friends, thank you very much. Welcome, Talha. Welcome. You joined late. You were asking 1 hour before the session, huh? But I think you're very busy in cricket nowadays, isn't it? Thank you very much for joining in. Thank you. All right. So I cannot take just MRCPI without MRCOG. You can take, my dear. Why can't you take Om? You can take, my dear. Please take that. And then you can decide about the July 2023 MRCPI. Okay. MRCOG July 2023 after March MRCPI. All right. Okay. All right, friends. So now we are going to do a comparison of one topic, and you people would understand that how we have to extract the common information. We are going to do the diabetes and pregnancy management from preconception to the postnatal period. We do have a wonderful, nice guideline, which we do in the European board, and we do for the MRCOG as well. And we have an Irish diabetes guideline as well. Now, the entire Irish diabetes guideline, that is similar to that of the NICE guideline, except certain values which are typical used in Ireland. The values are different, and I'll make you understand that where we have to deviate from the NICE guideline. Now, we've got two types of students. Firstly, who have done NICE guidelines so many times for their exams, and the others who are reading for the first time. The ones who are reading for the first time will do only the Irish tables. The ones who have been revising the NICE recommendations for so long, they will just put a stick-on their own notes of the NICE guideline and see the differences only. Do you guys understand this? Yes, you will open up your NICE diabetes notes, and you will put the stick-ons on the side, Irish recommendations 1, 2, 3, 4, 5. Your job would be done. Am I clear about the outline that how you have to utilize? Not from zero. Already you have made around 50 to 60% of the effort, and you're just going to add on to that. All right? Very well done. So the NICE guideline says that preconceptional planning is very important. Now I need your attention, please, because the gist which I want to give you today, that would go with you guys till March 2023, and you have to be very, very clear that what we have to prepare, how we have to prepare, and how we have to be successful in one go. Okay? Now, in the preconceptional period, both the Irish and both the NICE recommendation for RCOG and RCPI is that we tell the women that they need to have a very good control on their glucose levels just to be in the best shape of health to get pregnant. Therefore, in the preconceptional period, we check their glycosylated hemoglobin HbA1c levels to check that how far the levels are within the normal limit. This holds true for the Irish recommendation and for the RCOG UK recommendations as well. We have to tell them that if at all they are having the BMI above 27 kilogram per meter square, they are suggested to lose weight, and the NICE guideline says that these women are advised for having the folic acid 5 milligram per day until 12 weeks. Here, they say 5 milligram per day until 12 weeks. However, they do not tell about the preconceptional. So I will open up my notes. I will see that what does the Irish guidelines say, and I will put one stick on here, because the Irish guideline that clearly says that high dose folic acid 5 milligram is done, but at least 3 months prior and 12 weeks and the first trimester, that is 12 weeks gestational age. Do you guys understand? It's a minor point that the Irish recommendation is very clear that at least 3 months prior and 3 months after getting pregnant. So just add this one point. I would tell you guys to open up your notes, and you'll just add this one point 3 months prior and 3 months after getting pregnant. A fasting plasma glucose levels in the preconceptional period as per the NICE are 5 to 7, and the plasma glucose levels before meals are 4 to 7. Please forget this for the exam RCPI. The values in the preconceptional period, we will again change from that of the NICE, and we'll come to the recommendations. The Irish recommendations state that capillary glucose targets are recommended in the preconceptional period, fasting beer 3.5 to 5 millimoles per liter, and 1 hour postprandial less than 7 millimole per liter. Am I clear? Fasting being 3.5 to 5 millimole per liter, and 1 hour postprandial less than 7 millimole per liter. Very well done. So you don't have to worry. Everything in the preconceptional is same except this. So put a stick on or take another colored marker and write on the side of your recommendations of NICE that this is the change as compared to the preconceptional recommendations. HbA1c is the same in Irish and NICE. Less than 6.5 or 48 millimole per mole is taken to be the aim, where we allow the pregnant women that yes, preconceptional women, that yes, she can become pregnant, right? And we tell her that lesser is the HbA1c, better is the chance that we have a reduction in the congenital malformations in the baby. Both the NICE guideline and the Irish guideline, both of them, they say that when HbA1c is more than 10%, I repeat, above 86 millimole per mole, we tell them that the chances of having the congenital abnormalities are very, very high. So they have a consensus on the HbA1c values. Both of the guidelines, they recommend metformin as an adjunct or an alternative to insulin in the preconceptional period or during the pregnancy. So we have a consensus on the medications and the safety of the medications in both the guidelines for both the exams. We have a consensus on the retinal and the renal assessment as well. The retinal assessment, if it is being done in the preconceptional time period within 6 months, so that means it is fine. And if there's no diabetic retinopathy, so the cutoff is in the last 6 months, it should be done as the check for the retinal assessment for any patient who is in the preconceptional time period. And then annually, it has to be done if the patient is fine, otherwise a no diabetic retinopathy is there. Renal assessment holds the same in both the recommendation that we have to do for a patient in the preconceptional time period, serum creatinine, urine albumin creatinine ratio, the glomerular filtration rate, and if any of them goes into the abnormal value, we refer to the nephrologist, and that should be considered prior to she gets pregnant. That is, before discontinuing contraception, so that we know that what is her renal assessment by the expert physician. Please remember, both the guidelines tell us that in the pregnancy, we would do the serum creatinine, we would do the urinary albumin creatinine ratio. However, in the antenatal period, we skip the estimated glomerular filtration rate because of inappropriate value, because of the increased vascular and the blood supply to the kidneys. Therefore, in the antenatal time period, 2 tests would be done, serum creatinine and urinary albumin creatinine ratio. Please keep a note for a single-based answer. If she comes in the preconceptional time period, we will actually select 3 investigations. When she is in the antenatal time period, it would be 2 investigations that would be chosen, excluding the GFR. Now I need your attention. The risk assessment for gestational diabetes, we have got 5 risk factors where we call those patients for the oral glucose tolerance test. Why? Because they are high risk. That includes their BMI above 30 kilogram per meter square, a macrosomic baby previously weighing 4.5 kilogram or above, a previous gestational diabetes, a family history of diabetes, and a minority ethnic family origin with high prevalence of diabetes as well. But we've got a wonderful guideline, Irish guideline number 2, which has an obesity in detail, and they give us multiple factors where 2-hour 75-gram oral glucose tolerance test is being done. And they tell us in the Irish recommendation, if the patient has got BMI more than 30, please remember the maternal age is not given in the NICE guideline. But if maternal age is more than 40, we do perform OGTT as per Irish recommendation. If previous unexplained perinatal death was there, we do perform OGTT in this pregnancy. With current glucosuria, a patient who is taking long-term steroids with previous macrosomic baby is the same recommendation. When the patient has got a polycystic ovarian syndrome, she's got complication in the existing pregnancy, and if she belongs to the high-risk ethnic group. So we have certain additional points for the indication of OGTT. Again, when you open up your NICE recommendations, you can simply write on the side that these are additional, like maternal age more than 40, right? Previous unexplained perinatal death, like polycystic ovarian syndrome. And with macrosomia current, polyhydramnios in the current pregnancy, we are going to do OGTT to confirm that this patient has got diabetes or not. Am I clear? Am I clear? 5 points you already know. So we are adding on to that. So we know that Irish recommendations are higher than that. Javaya Somro, am I clear? Mehreen, Faridi, am I clear? Talha, the indications which are more for the OGTT in the Irish setup, are you people clear about this? Yes? Okay, perfect. Thank you very much, Vifak. Thank you, Faridi. Thank you, Zoe, my dear. Now, glucosuria, same if it's 2+ or above on one occasion or 1+ or above on 2 occasions, we have to confirm that it is gestational diabetes or not. That is common in both the NICE and the Irish guideline as well. Coming to a second big difference. It was very easy for us to remember the oral glucose tolerance test, friends and family, for 5, 6, 7, 8, which we used to do in the RCOG exam. Please remember that there is no 5, 6, 7, 8 when it comes to OGTT in the Irish setup. The guideline says that the fasting 5.1 or more, if at 1 hour it's 10 millimole per liter more, 2 hours 8.5 millimole per liter. So these are the values to diagnose on 75-gram oral glucose tolerance test. Point noted, everyone? The OGTT values in diabetes are different for that of the confirmation which are being used in UK. Am I clear? Did you guys understand the difference, please? These values we would be remembering for our single best answer when it comes to the MRCPI written exam. All right. And even in the OSCE students, they said the same when it is a Viva question from the examiner. For MRCPI, the diagnostic values would be this. The management plan, fortunately, stays the same. We are going to give this patient, if fasting glucose is less, we would give a trial of diet and exercise and metformin if it doesn't work, and then insulin. Even one value above this level, Zoe. Yes, a very valid question, even one value if it's above that. If at all the fasting glucose is 6 to 6.9, we consider immediate treatment. And if it's 7 and more, we offer immediate insulin treatment. Please ensure that you remember this for the single best answer. And the glibenclamide would be only for those women either who are not having a successful management plan with metformin, or they cannot take metformin, or they cannot tolerate or are having the contraindications to this medication. How many times do we check? For the type 1 diabetes, same monitoring as we had in the NICE, same as in the Irish, that we are having 7 checks. Very well done, Faridi. Very well done, my dear. Fasting, pre-meal, 1 hour post-meal, and bedtime. How much does it make? 1 is fasting, correct? Then 1 is 2 are pre-meal, pre-lunch and pre-dinner. 1 hour post-meal at 3, and 1 bedtime. So that makes a total of 7 checks. Am I clear? How did we make the 7 checks? Am I clear, friends, that how did we make? Yasmin? Yes, how did we make 7 checks? Yes, 7 checks are clear? Perfect, Anam. So the other is type 2 diabetes. In type 2 diabetes, we have 1 fasting and 1 hour post-meal, so 3. So 1 plus 3 is going to be 4. 4 checks in the type 2 diabetes. Ensure if the type 2 diabetes or the gestational diabetes, friends, that is having multiple insulin administration. So my question to all of you is that if type 2 diabetes or the gestational diabetes is not on oral management and not a single agent is being used, multiple agent is being used for the diabetes control for insulin. Thank you, Mehreen. This calls for a very old information when I used to teach you NICE guideline, Mehreen. Yes, type 2 diabetes and gestational diabetes on multiple daily insulin injection would be same as that of type 1. That is 7 times we are going to check. Same as that of type 1 diabetes. Now coming to the pregnancy. The NICE guideline says that we advise the pregnant women with any form of diabetes to maintain their capillary plasma glucose below the levels of the target. Now, the NICE guideline says fasting 5.3, 1 hour 7.8, 2 hours after meal 6.4. I'm sorry again, but we have to forget this for our CPI. Because diabetes during pregnancy, our CPI says that pre-prandial and pre-bed would be 3.5 to 5. 1 hour post-prandial would be less than 7, and that's it, right? They say that the target capillary blood glucose levels and the HbA1c targets should be explained. Again, pre-prandial and the pre-bed less than 5, and 1 hour post-prandial will be less than 7. So now with the older, if anybody has remembered the older values, you people would forget that sitting in MRCPI and you would remember these values. Or if anybody is doing for the first time, would do these values for this exam. Am I clear? What's the basic difference? Did you guys understand, please? So far, yes? Everybody clear? The retinal assessment, thankfully, is the same, Seher, that we do at the first antenatal appointment. If it's been done in the last 3 months, we do not repeat. And again, we do that at 28 weeks. If the patient has got diabetic retinopathy, then we do that at 16 to 20 weeks, an additional retinal assessment. Same as the renal assessment would be within 3 months. If it's done, we don't repeat that. We have it after the booking and we check. Other than the glomerular filtration rate, we have the other investigations for which we check. Any patient who has a nephrotic range protein urea, 5 grams per day, that would be an indication of thromboprophylaxis. When I will do the maternal medicine with you all, we will do the venous thromboembolism differences the same way as I'm doing the diabetes differences with you guys. Now, we perform an ultrasound in the diabetic mother for detecting the structural abnormalities. And also, we need to check the examination of the fetal heart at 20 weeks. If at all, the patients, they receive steroids, because steroids are hyperglycemic, we may give additional insulin. And both the guidelines, they have a consensus on this recommendation. Now comes a very important point, which I want you to register, because that's another basic difference after the investigation. We will do that. Yes, my dear. The gestational diabetes, if no complication is there, the NICE guideline says that 40+6, we can deliver the patient by that time. Again, you have to ignore that for MRCPI exam. The guideline says that the frequency of fetal monitoring should be increased if the pregnancy is allowed to progress beyond 40 weeks of gestation. And even if the patient has got excellent glycemic controls, adherence to the treatment, and absence of any compromise, women with diabetes may await spontaneous labor up to 39 to 40 weeks of gestation. So what we'll remember for MRCPI is not 40+6, 39 to 40 weeks of gestation. Similarly, the NICE guideline for the type 1 and the type 2 diabetes with no complications says that we may take them till 37 to 38+6 and with complications earlier than 37. Again, we have to forget this because what we'll remember is that in the presence of the obstetric or diabetic complications, they say that should be considered at 38 weeks. What is the difference? The difference is that they say it is going to be earlier than 37 or till 37, but the Irish setup allows us even with complication till 38 weeks. We are talking about a known diabetic patient. Am I clear? Is this point noted, everyone? Everybody clear, please? The ones who are not active in the chat, I want all of you to be active. Yes, please tell me that is this point clear? Perfect. Very well done. Yes, everyone who is silent, please. I need everybody to be interactive and everybody to be active. That's perfect. Thank you. And if at all, we have to do NUR, elective cesarean section, that is best performed at 39 weeks rather than 38 weeks gestation in the absence of the complication. So thank you, Namath. Happy to see you, my dear. Thank you very much. Thank you, Haifa. Very well done. Everybody, please be attentive. These points, if you learn today, you will just have to revise once again. The memory would be better. Just register these points, which are the differences. That's it. Thank you, Raga. Very well done, Saira. Ensure that you people understand that here it is going to be 39 to 40 when excellent glycemic control is there. Both, thank you very much, Talha. Well done. Talha, both in GDM and both in type 1, type 2 diabetes, they say if the glycemic control is fine, let them go to 39 to 40 weeks. And if the complications are there, then it would be 38 weeks. Anesthesia, for general anesthesia, both of the guidelines, they say that every 30 minutes, we are going to have a check for the glucose control, and 4 to 7 is a consensus, luckily, both in the Irish guideline and the NICE guideline, that we are going to keep the control in 4 to 7 millimole per liter. Both have the same consensus. The Irish and the NICE recommendation, both are the same, 4 to 7 millimole per liter in the labor and delivery. So intrapartum values are luckily the same. During the vaginal delivery, they say 4 to 7. And they clearly say that during an anesthesia, they do not say 30 minutes. What they say is that it won't be hourly. During general anesthesia, frequently we have to monitor the blood glucose levels. RCOG says that we have to do every 30 minutes. MRCPI says hourly is in labor. Here we have to do frequent. So we take the recommendation from the NICE because here we don't have specific timings. So every 30 minutes under the general anesthesia, it would be taken. Thank you very much. Half an hour NUR. In labor, it would be 1 hour. That is 60 minutes. In general anesthesia, it would be 30 minutes. Okay. Now the babies, we are concerned about the neonatal care. Why, Noor Mohammed? Because we expect certain complications, babies born to the diabetic mothers, like polycythemia, hyperbilirubinemia, hypocalcemia, hypomagnesemia, and we are concerned about the congenital cardiac problems in the baby as well. So we admit those those neonates who have the signs, the clinical signs of hypoglycemia, respiratory distress, neonatal encephalopathy, polycythemia, and they require additional management. They're getting hypoglycemic. So the preterm babies, both the guidelines, they say that they require additional care. And to prevent hypoglycemia, we should give them written policy. And we should understand that they should have frequent feeding as well. Here comes another difference. Please open up your notebooks. The capillary plasma glucose values below 2 millimole per liter is taken to be in NICE as hypoglycemia. And they say that early feeding within 30 minutes and every 2 to 3 hours, we start feeding in 30 minutes, and every 2 to 3 hours, we should have frequent feeding. So in Irish guideline, they say that hypoglycemia is when the blood glucose is less than 2.6. Difference noted? NICE says the neonate is hypoglycemia in less than 2. The Irish recommendations say that the baby is hypoglycemic less than 2.6. Am I clear about this tiny difference, please? Point noted, everyone? Is this point noted, everyone? These are slight points, but if you remember these, you would have such a good grip over the guidelines. Nobody can beat you in a single best answer if you people read with comparison. The postnatal care, they say, immediately you might have to reduce the dose of the insulin. Why? Because the chances of the requirement of the insulin are reduced. So they say that postpartum insulin regimen, that should be like, very good, Hua, my girl, very well done, like pre-pregnancy she was taking. And they say postpartum also, we should maintain 4 to 7. This is not given in RCOG. Postpartum RCPI says 4 to 7 maintained, same as that of labor. Now again comes a big difference. If we recall our NICE guideline, you people remember that they told us to do fasting plasma glucose at 6 weeks to be sure that it's not a GDM. And if it's not done, they say at 13 weeks, we can do HbA1c. Do you guys remember? What investigation? Everyone, please, I need your attention here. All the neurons towards my side, please. Do you guys remember that what is that investigation which is done postpartum to check that the patient had GDM and now she's better? What is that investigation in the NICE guideline? Fasting, very good, Faridi, and HbA1c NIMC at 13 weeks, very good. And they specifically say one thing, that this investigation should not be done postpartum. Do you guys remember? What is that investigation they say? Which should not be done postpartum. There is a specific investigation they are saying that you should not do postpartum. It should not be routinely mentioned. So please forget this recommendation when you are sitting, Anita, in RCPI. Because RCPI clearly says that a 75-gram World Health Organization criteria for the non-pregnant population should be performed at 6 weeks postpartum and then annually. This is a very big difference. RCOG says do fasting, sugar levels, and HbA1c. RCPI says, and RCOG says do not perform routinely OGTT. RCPI says for all patients who have given birth who had GDM would undergo OGTT at 6 weeks postpartum and then annually as well if it's normal. Did you guys note this point? Did you guys note this point? If these differences you people note down, nothing would be a difficulty for you guys. Am I clear about this oral glucose tolerance test postpartum? We never select that when we actually talk about the RCOG recommendations in the postpartum period. And we always select that when it comes to the postpartum Irish question. It's a confirmed single best answer. It is your recall question of all exams of September 2022, March 2022. They ask you that the patient had GDM, investigation to confirm and to see and assess her state. You people will select 6 weeks postpartum oral glucose tolerance test, right? If anybody has not read this guideline, they would go with fasting or HbA1c as per the RCOG recommendations. Because RCOG clearly says not to do that in routine, RCPI says please perform OGTT at 6 weeks. Could I make myself clear, please? Are you guys following me for this, please? Yeah? So the postpartum, we have got WHO levels of diabetes, impaired glucose tolerance test, and impaired fasting glucose. This is what we need to remember. At 6 weeks postpartum, we would have her World Health Organization recommendations, please. All right. Now, if I tell you guys, we have done the detailed guideline, all the NICE and the recommendations of Irish. If I give you 3 slides and I tell you that if you do these 3 slides, nothing would be a trouble, and you attach on your same notes, your topic would be done. As students were saying that at the end of the day, they used to do only those flashcards, which I provide in the session. The Irish diabetes type 1, the glucose target in the preconceptional period, the blood glucose levels during the pregnancy, during labor, during C-section, during general anesthesia, and postnatal as well. The Irish guideline recommendations type 2 diabetes, glucose target in preconceptional period, during pregnancy, during labor and delivery, cesarean section, and postnatal. Gestational diabetes, 75-gram OGTT levels, diagnosis on the basis of fasting, 1 hour, 2 hours, the targets during pregnancy that have to be met pre-prandial and pre-bed, 1 hour post-prandial, during labor and delivery, during cesarean section, and at 6 weeks, we have to do 75-gram OGTT, then yearly thereafter. Did you guys understand? This is the gist which was in different recommendations in different part of the guidelines, and only these are the differences of the Irish guideline and the NICE guideline. Rest, everything is similar. Every part is similar. If we take out the values and we learn these values, nothing would be a trouble for you guys. Because at the end of the day, this is what, if you reproduce, your job is done and your topic is completely covered. Am I clear, please? Yes? So you just have to do these flashcards, which are going to be posted and uploaded. After doing one-time complete guideline, you learn from these flashcards and you just revise them for like 5 to 10 minutes. And you understand, if somebody asks you, you always say, students while doing the session, they say, ma'am, how do you remember? This is what you have to do in European board. This is what you have to do in Irish recommendation. I always say it's only then when you have a grip over that, you make a comparison, your things are very easy. And you can learn that in a very quick manner, right? Everything would be there. So I'm going to post that in your group, and this recording would be uploaded on your portals as well, right? So you'll have that in the records. After each session, the recording would be uploaded and you can revise it as many times as you want. All right, so this is how we are going to do all the topics in the course. We will start from gynecology. Those things which are different, we are going to do them, and we are going to make it easy for all of you. I'm sure that after doing the sessions, you'll have a very good grip and you'll be very strong. When the questions would be coming up, you'll understand that the single best answers, they're easy for you because you'll understand, yes, even solving the books, Andrew Sizer's, when students are following that, the fetal growth restriction, that's different in RCPI and RCOG. And students, they say, ma'am, RCOG answer is A, RCPI answer is B. Yes, and I'm going to post that in the group, my dear. Hina, just now, you can put it there as well. Thank you so much, my dear Hawa. Remember in prayers, thank you. Yes, Zo, it would be there. Thank you. Any questions, please? Students are messaging privately on the WhatsApp, friends. All those who want to know about the course and the details, please. All the live session schedule has been given there. I would suggest that we are going to decide about the timing just in a bit in the study group. And we are going to have all the pools, the practice pools. It's sufficient to do whatever is on the website. You don't need anything extra. For the next booking days, it's going to be 449 reduced to 224, please. You people, newcomers, can use the coupon. All those who are in the premium groups already, please use your extension links, and the new students are going to have this 50% off. After that, it would be again rising up to the complete price after these 24 hours after the booking, it's over. All right, please, Javeria, you want to say something? You raised your hand, my dear. Yeah, sure, please, Javeria. I'm happy for the question, please. Aisha, join the course, but follow that after January. Okay, joining now is beneficial because there would be certain revisions you people can do. Aisha, okay? Yes.
Hello,
Aisha, hello, my dearest. How are you doing?
I'm good, ma'am. Alhamdulillah.
How is Haris? I hope he's fine. Happy to see him a few days back.
Yes, actually, he is fine right now, but the previous month was very hectic for me, my entire family, kids. Repeatedly, every week they were taking influenza tests, throat swabs, everything has been negative, and it's still high-grade fevers running and all these things.
Yeah, lots of prayers, my dear. Many students are complaining of the same, so lots of prayers. Yes, Javeria, my dear, please come up with
ma'am. Since this is basically SBA single best question exam, so like you told that during anesthesia, RCOG says, NICE guideline says that every 30 minutes, and they in Irish guidelines they have just said frequently.
Frequently, then labor.
Yes,
so
frequently.
when they say that in labor is 1 hourly, they say more frequently. So we take the 30 minutes to be true.
I understand that, but what if there are exactly the same words, like 30 minutes is one option and the second option is frequently? So since
frequently,
it
has to be in comparison, right? Frequently, then in labor. If they say this, then it would be the best. Yes. Then it's the exact words of the Irish recommendation.
That's what I wanted to ask. Yes.
Yeah,
Thank
correct.
you.
Then it would be accurate words of the guideline.
Okay, got it, ma'am. Thank you
so much. Thank you. All right. Seher, the schedule you people are following in the open group, that will be for the open group. You people will have your module-wise schedule that would be posted and the gynae would be started. All right. Yes, the moderator is going to guide you on this. Okay. All right, Sabrina, the recording of all the sessions would be uploaded on your portal, on your website. Once you log in there, all your questions are there. I'm going to have the single best answers update with you guys till 2022 TOG articles. All SPAs would be with you guys. They're made from the lines of the TOG article because every time around 10 questions out of 100, they are typically made from the TOG articles. So you will get all the recent TOG articles till publication 2022 October. Okay, Marine, the same login, my dear, like you used to have your MRCPI Part 3, Marine. You'll just go onto the login of the RFA website and there on your portal, my dear. Okay. Yes, Yasmin, from 2015 till date, we have got all the recalls and wonderfully solved them. Yes, and students, they're really fond of that because we make comparisons and we solve them. Okay, Yasmin Khan. All right. Mona, what do you guys say? I wanted you to discuss with you guys in the study group because many students, they wanted morning GMT. So you people can decide, Mona. Please write in the study group. All the sessions, dates are there. Please come up to a consensus for a time and we can just announce that accordingly. Okay, I can understand, Yasmin. Yeah, sure, Marine, please write in the study group. I'm going to make a consensus for you guys. The MRCPI group. Okay, my dear, I can arrange that. All right, I'll talk to the coordinators all, and for your ease, I can arrange that. All right. Yes, that's fine, so because MRCOG people are doing that there. So I'll talk to the coordinator and the moderators, and then we are going to arrange that in our group. Okay. Right. Okay, that's perfect. Any other question, please? Are you people clear about the curriculum? May I ask about the ebook, Muna? Please. Okay, I'll look into this, my dear. I'll look into this, Muna. We'll talk with the team, the backend team, and let you know about this. Okay. Mehreen, I would suggest doing recalls after 30-35 days, please. It would be too early because you people would be blank, right? Books, I suggest we have to start now. Yes, exactly, Javeria. And Javeria, take the lead, make a schedule and book, start from the single best answers, tiny books like Amanda Jones, Seema Sharma, start doing that. We'll put a schedule for them and start doing those single best answer books. Recalls, we are going to start, and that would be moderator would be doing from 2015 onwards. We are going to start around 30-35 days because I want that at least you have the flow of the learning and then we start doing it. And we'll do 3 times, okay? So don't worry at all, okay? Yeah, sure, Javeria, please. Yes, my dear, we're going to organize that. Yes, please. Seher, ma'am, the book of the SPAs, it's updated or will be updated again. Only September questions 15, 20 are going to be updated, but we'll add on to that. All right. Yes, sure, please, Javeria. I'll tell you all the SPAs books are important. So mark them earlier and leave EMQs for the moment. In the second go, we can do if at all SPAs are finished. But SPAs, if we do them completely, they will be sufficient. All right. Thank you so much, Mehreen. It's always a pleasure having you, my dear. Thank you so much, my dearest. Oh, Shabnam also wanted to join. She's gone for marriage, but she also wanted to join. So she'll be joining soon. Yeah. Okay, Vifaq, all we do in the same group or in other groups? My dear, stay in the same group. Your premium group, that's better, that you guys stay in that group. All right. Javeria, that has to be done. I always do the single best answers from there, and I always suggest that. It's always better. Yes, it's very, very important because 10 to 20 questions, you have a very good grip if you follow those questions. Yasmin, in the group they do, and in the fast track, I do all the recalls by myself. But the fast track would be just like 15, 20 days before the exam, somewhere in the mid of the February. Okay. Thank you so much, Seher. My pleasure, my dear. Happy to see you guys here. Thank you so much. Thank you. Yes, please. Any other question? Did you guys understand about the curriculum, all those newcomers? Did you guys understand the curriculum about the MRCPI? Yes. Did you people understand that how we have to apply? I want on the very first day, in the very first 30 minutes, all the applications to be done. No delay, please, Moini. Okay, no delay, Faridi. Everybody has to plan giving up the applications, filling in the first 30 minutes, please. Okay? That's awesome. Thank you very much. Thank you. Any other question, please? Thank you very much. My pleasure. Yes, my dear. Hello, Mustafa. All right. I think Mustafa is at work. Okay, thank you very much. Nema, generally, it's last time it was 9 a.m. Irish time, but be ready by that time. If they're going to do any update, I would definitely announce in the study group, in the open group as well. Okay. All right. Yes, definitely. Yes, there would be an announcement. Don't worry. But be ready around 8 a.m. or 9 a.m. Irish time. Okay. Your documents should be ready with you today, right? And on that day, we are just going to upload. So it would just be a click away. Okay. All right. Thank you very much. Thank you very much, friends. It was lovely being with you guys. I'm really grateful to all the students who have joined. Thank you, Abia. Thank you, Aisha Mazhar. Thank you, Brian. Thank you, Hawa, Iman. Funmi, my girl. Thank you, Fadwa. Thank you, Fahima. Thank you, Ghazal. Thank you, Hina. All of those who are here from the open group as well. Thank you very much for joining in and taking out your precious time. Oh, I can see Manikam here as well. Thank you very much, Manikam. You were quiet, my dear. Thank you. You're my MRCPI Part 3 open group student as well. Thank you, Marwa. Thank you very much. Thank you, my dearest. Thank you very much. All right, friends. So this calls for a day. I hope you people have understood the gist of the MRCPI preparation and you're in a better position to take this exam now. See you all in this study group. I would just like to say that let's take a focus start. Let's aim success today. I would like to emphasize on this fact again, that every exam is easy if we do the hard work and the smart work, and we are persistent and we are taking a confident start. We'll stay confident till the very end. Thank you so much. I want the same enthusiasm. I want the same motivation and the positive vibes, the zeal and zest in the study group as well. Best of luck from the entire team of RFA tutors. Thank you very much. See you all in the next session, starting up with the gynecology. Bye-bye from my side. Take good care. Love you all. See you guys in your study group. Bye-bye. Thank you very much for joining in. Thank you.